Welcome to OECD Podcast, where policy meets people.
Hello and welcome to Behind the Numbers, a limited series where we talk to experts working on the data that shapes our understanding of our economies, our societies, our environment, the world in which we live. I'm Ashley Ward, and today we'll be diving into the Patient-Reported Indicator Surveys, PaRIS for short, an OECD initiative that puts patient outcomes and experiences at the centre of healthcare assessment. For far too long, healthcare performance indicators have centred on inputs, like funding and infrastructure, or processes, like hospital admissions or waiting times, without adequately capturing the experiences and outcomes of the people receiving care. PaRIS upends that dynamic, shining a light on how patients feel about their care and how their lives are affected, and focusing on the largest and fastest growing group of healthcare users, people with chronic conditions. The final results are now out, covering more than 107,000 patients in over 1,800 primary care practices across 19 countries, and they raise a fundamental question: does healthcare truly deliver for patients? To tell us about the surveys and help us unpack the findings, I'm delighted to be joined by two health economists from the OECD Directorate for Employment, Labour and Social Affairs, Frederico Guanais and Michael Vandenberg. Thank you both for joining me.
Thank you very much, Ashley. It's great to be here today.
Thanks for having us today.
If you'll humour me, I'll start with an unattributed and adapted Arabian proverb. She who has health has hope, and she who has hope has everything. Clearly, our health is important, facilitating all things that bring joy and meaning to our lives. Health and healthcare are also important policy and measurement issues, and a domain well covered by your directorate. So I'd love to start with you, Frederico. In your view, why do we need to be talking more and taking policy action on health and healthcare?
That's right, Ashley. The proverb you quoted says it all. Being healthy is a fundamental requirement for pursuing our dreams, our plans, our aspirations, whatever we want to do in the future. So we all want to be in good health and enjoy the things that matter most for us. Similarly, from an economic perspective, a healthier population is also a more productive one. So whether you look at this as an individual or as a society, it's very clear that helping people stay healthy for as long as possible is absolutely essential. But of course, this is a moving target. The good news is that life expectancy has increased by more than a decade since 1960 across OECD countries. It now averages more than 80 years at birth. The flip side, though, is that, of course, population aging. We're reaching a point where nearly 20% of people are over 65, and by 2060, that could rise to almost 30%. So the real important policy question is, to what extent does healthcare actually help people stay healthy as they age? This might sound quite obvious, right? After all, the very purpose of healthcare is to improve health. But in practice, it's much more complicated. We estimate, for example, that around 20% of all spending in healthcare is wasteful. That means that 1 in every $5 or euros spent does not actually improve people's health. And sometimes it even causes harm, for example, in the case if there is a patient safety incident. And adding to that, healthcare already accounts for nearly 10% of the GDP and about 15% of total government spending across OECD countries. Now, we're living in times where government budgets are under extreme pressure from multiple crises. So the challenge to making sure that every euro or every dollar spent actually translate into better health and well-being becomes even more critical.
Completely right. Now, steering towards measurement, how do you go about assessing healthcare systems and providing advice when there's such heterogeneity across countries? Can you tell us a little bit about the challenges of finding good quality and comparable data when it comes to healthcare?
This is really the bread and butter of our daily work. Let's take a relatively simple example, right? Comparing how many doctors different countries have. We usually measure that as the number of doctors per capita. It sounds straightforward, right? But then you have to ask, are we counting everyone who ever graduated from medical school? Or only those who are licensed to practice? or only those who are actually seeing patients, people who are actually in the office seeing patients. So definitions matter, and they can seriously affect the numbers. So we work very closely with countries to ensure that the data is comparable based on a common and shared definition. And for basic metrics like that, most countries have administrative databases we can rely on. But then when it comes to more complex concepts, like the outcomes of healthcare systems, things get a lot trickier. So we're talking about things like physical health, mental health, and overall well-being, the things we ultimately want to maximize for everyone. And yet, most countries do not collect this kind of information routinely. To really understand how people are doing, you have to ask them directly. And that's exactly why we need a large international survey like PaRIS. But even there, it's not as simple just as asking, how are you feeling today? Measuring these concepts across different languages and different cultures means that we have to use internationally validated scales. So that way, responses to different questions are combined to give us a robust, comparable picture of people's health, including physical health, mental health, and well-being. And that's what we built into the PaRIS survey.
Thanks. I mean, that makes complete sense on the concepts and definitions, making sure that we're all sort of aiming towards the same target, the same bullseye, even if different countries might miss that bullseye in different ways. And you mentioned PaRIS, so we'll get to that now, the topic of our podcast. Why has it taken so long for health systems to collect and compare data on patient outcomes and experiences of healthcare? What makes this international survey truly first of its kind, and how does it improve on existing healthcare indicators?
It's really an exciting moment for us. Getting these first results took more than 7 years of hard work from a lot of people. And yes, it's quite surprising that for so long we've been assessing the performance of healthcare systems without even systematically asking patients about their own experiences and outcomes of care. Over the general field of public health research and health services research and health economics, this has been a gradual evolution over perhaps a century or so, starting all the way from measuring deaths, right? Then to measuring diseases, then to measuring disabilities, and now finally to measuring health and well-being. Of course, counting deaths is much easier than systematically capturing how people experience their own health.
Of course, I mean, that makes sense on the surface, but how do you go about doing that?
So even before launching the survey, we spent years working with patients, healthcare professionals, policymakers, researchers, and experts, because we wanted to make sure that we're really measuring the outcomes that matter the most to the patients themselves, but in the same time in a scientifically rigorous and policy-relevant way. The result is PaRIS, the largest international survey of patients with chronic conditions. We surveyed over 107,000 people aged 45 and older across 1,800 primary care practices in 19 countries. So we now have comparable data not only on the physical and mental health and well-being, but also on patients' experiences. Things like the quality of care people received, their trust in the healthcare system, how patient-centered and coordinated their healthcare was, and also information about the primary care practices themselves, the characteristics of the practices where people receive care. So this is a truly unique and groundbreaking data set that lets us explore what types of care leads to the best outcomes, who is being left behind and needs more support, and how we can shift healthcare from simply being fixing problems to truly delivering better health and well-being.
Thanks, Frederico. Now, Michael, it's your time to shine. Let's talk findings. The new PaRIS results indicate that 82% of primary healthcare users in the 45 and older age group live with at least one chronic condition, and over half manage two or more. What do these new figures tell us about patient experiences and outcomes, especially those with multiple chronic conditions?
Yeah, this figure of 82% is indeed quite striking. Also, if you realize that we didn't know anything about these patients before we sampled them, right? We sampled people about 45 years and older, and it turned out that 82% of those live with a chronic condition. It has become, through the times, it's become increasingly common that people live with multiple conditions. And in our sample, we see that more than half of the people have 2 or more chronic conditions, but even living with 3, 4 or more is not an exception these days. And as you can imagine, this leads to many complications in people's daily lives, right? It's therefore that we have measured not only what happens in the clinical setting, but also what happens in people's lives. And a good example of that is that we have an indicator called social functioning, which really touches on a lot of things that matter in people's daily life. How do they function at work, as a spouse, with their children, in all these daily activities? And you see that every additional chronic condition that people have a further negative impact on that. As you can also imagine that from a policy perspective, we of course want to know how could we make it better for these patients? Because healthcare systems are not necessarily designed on people with this whole cluster of different chronic conditions. They often structured in a way like something for the cancer patients, something for diabetes patients, but people are facing this whole cluster of different conditions. They're seeing different healthcare providers, they're taking several medications, and they're trying to navigate their way through the healthcare system. And well, the study is very comprehensive, so difficult to summarize. There are a lot of statistics in there, but there were 3 major things that came out of our study, and which we call now the 3 T's: time, tailor-made care, and trouble-free care. So as you can hear, these are not advanced technologies or innovations. These are very straightforward concepts. For example, time refers to the time that can be spent on an individual patient during a consultation, the time that people are seeing the same primary care provider throughout the years. And we see that there are clear relations between that on the one hand and outcomes, the experiences of care, and also the trust in healthcare that people have on the other hand. And the same is what we see for tailor-made. So is the system designed in a way that to serve the needs of patients, their individual needs, or does the patient have to adapt to the system, right? And the last thing, what we call trouble-free, so that things are organized in a smooth way, that information can flow easily from one healthcare provider to the other. You don't have to repeat all the time to different healthcare providers. Also, your medication is well coordinated. There's a sort of plan around the patient. So that's what we call a trouble-free care.
So you mentioned that it's difficult to summarize these results over such a comprehensive study. Frederico mentioned 107,000 patients over, I think, 19 countries. So where do we see the most variation?
So in this study, we have looked into so-called PROMs, patient-reported outcome measures, and on the other hand, PREMs, patient-reported experience measures. So an outcome says something about how people experience their health. So, for example, physical health, mental health, well-being, and so on. On the PREMs, we're asking people about how they experience the care they received. So how well the care was coordinated, how they rate the quality of the care. And what we generally see is that, particularly on the PREMs, on the experiences, we see striking differences. While, for example, an indicator like well-being, that is affected by so many more aspects of people's life, and that go also way beyond the healthcare system. But an indicator like coordination of care, that's something that healthcare policy and providers have a direct influence on. And there we see quite striking differences between countries. Another example, what strikes me is the question about trust. So we ask people to what extent they do trust the healthcare system, which is a bit of an abstract question, but it's quite essential for how people will behave in such a system. And we see a wide range between countries, varying from less than 50% saying that they trust the healthcare system of the country they live in, towards countries where 3/4 of the population say that they trust the healthcare system. And what also strikes me is the differences that we see in the answer to the question on experienced quality of care. So we ask people, how did you experience the primary care received? You see substantial differences between countries. And as you can imagine, they partly relate to the level of health spending. So the countries that's spending more, in many cases, they also have better scores on experience quality. But that relation is not straightforward. So we also see that some countries who are not typically big spenders, like Slovenia and Czechia, they score pretty high on experience quality. And so long story short, we see that some countries, they perform similar on these types of experience measures while only spending half of other countries.
Yeah, that is quite a surprising result. More money doesn't necessarily result in better experiences. So were there any other results from PaRIS that surprised you? Any common hypotheses or misconceptions that maybe were debunked?
Well, one of the things is we often have ideas about which countries are typically the strong performers and the lower performers when it comes to healthcare. And a more surprising element that we see in PaRIS is that the countries that are known for their high life expectancy are not necessarily the best performers when it comes to patient-reported measures. So that relation is not that straightforward. Another element, and well, I know that this might not come as a surprise, but it's called the so-called gender health paradox. So while women typically live longer than men, you see that they consistently report a lower level of physical health, mental health, well-being. They always score lower. And even though we knew this, what I found quite striking is that it is so persistent, even when accounting for factors like age, socioeconomic status, migration status, all these factors taken into account, you still see that these gender gaps are quite persistent. And lastly, one thing that I found quite intriguing, and we're going to dig into a little bit more in the coming time, is when we talk about chronic conditions, we often tend to think of older people. And however, this is a mistake. Like the relation between age and health outcomes is quite complex. And while you would, for example, expect that older people score much worse on, for example, physical health, this is not always the case. And this could be related to certain expectations that people have related to their own age. When getting chronic conditions at a younger age, the impact can be huge. Because, for example, if you're 50, you live with two different chronic conditions, you will compare your own situation, your condition with people around you of a similar age. While when you're 80, it has become sort of fact of life that you live with certain chronic conditions. So the impact, is always huge on people's life, also when you're older. But I think that there is an intriguing interaction with age here, and this is something that we are going to further explore in the coming time.
Yeah, that last point really hit me. When you're older, it can really feel like a sort of cost of doing business, having chronic conditions, and experiences are really, really relative. So now let's zoom out a little bit. PaRIS helps policymakers, patients, and healthcare providers. Can you elaborate on the value added for these different groups?
Yeah, sure. I can give you an example of all of these. Particularly for policymakers, this opens a whole new domain of relevant steering information, because we're not the first who are working on patient-reported outcomes and experiences, but until now, there are a lot of different small-scale initiatives, usually in the clinical setting. They're not necessarily generating policy information. And what we do here is we provide policymakers with a new angle on healthcare performance. And it's quite ironic that everybody agrees that healthcare is all about patients, but until now we seldomly ask patients actually how healthcare impacts their life, how they experience it. So for policymakers, this provides an important source of information on how well the system is serving the needs of people. When talking about patients, it's also important to realize we have not just developed this whole study here in Paris, we have done this together with patients. So from the very beginning, patients have been on the table. They have been involved in every step of the project that we took, also to make sure that what we ask makes sense to patients. And they have let us know that they find it very useful also for their advocacy, and also just to make their voice heard in how we look at performance of healthcare systems. And the last one you asked me about healthcare providers. Well, healthcare providers, we needed them for this survey because, as you know, we have sampled primary care practices and then the patient in those practices. And many healthcare providers are quite keen on having this data. So we have provided a feedback report to them where they can see how their population is faring in terms of outcomes and experiences and how this compares with peers. So for them, it's an interesting mirror information, so to say, on the performance of their own practice.
It's really interesting to hear. I mean, we often talk about helping countries to benchmark themselves against each other, and obviously that's one thing that we can do through this survey, but at a more granular level, helping healthcare providers to benchmark themselves is maybe one step more valuable, or at least more practical. But back to you, Frederico, to finish. Let's talk practical applications. How can governments or healthcare institutions use PaRIS data to target improvements in primary care? Could healthcare spending be better prioritized or more effectively organized to best serve healthcare users?
Sure. That's what we all want with the survey, to improve healthcare. So Michael said that higher spending is not necessarily linked with better performance. So the good thing about PaRIS is that it also provides very concrete and actionable policy recommendations that any country can use to improve care for people with chronic conditions, to improve those PREMs and PROMs, the patient-reported experiences and outcomes, like we've been talking about. So let me give you just two examples. I could give many, but let me focus just on two. First, boosting health literacy, especially digital health literacy. Right? How many times do you actually go to the doctor's office and you don't understand anything that they say, or you don't understand the recommendations, and you really wonder what you should do next to manage, especially with a chronic condition or 2 or 3 chronic conditions. So data from PaRIS shows that only about 20% of patients trust the health information they find online, for example, right? And this could be a result of many things. But there are things that policymakers can do to make patients' lives easier. For example, in PaRIS data, we find that 60% of people with lower education find the information that they have on their primary care provider's website difficult to use. Right? So 60% really are struggling to understand what's even on the primary care provider website. So making online information more accessible would be a clear win and a concrete policy action that countries can take. Second example, and it's related to that. So we need to provide more support to help patients manage their own health, especially those who have 1, 2, 3 chronic conditions. And the results of PaRIS show that patients are not receiving enough information to manage their own health, like in a written format or actually advanced methods of patient support, such as patient training sessions or lessons, things like that. We find that only 60% of PaRIS patients report that they're receiving any kind of written information beyond the verbal instructions they are giving during the consultation. So I think for all of those areas, digital technology can play a key role, but it needs to be implemented thoughtfully in ways that empower both the healthcare professional and the patients. And PaRIS can be really, really a game changer into finding targeted interventions that countries can do to improve the effectiveness of their healthcare without necessarily spending more for that.
Before we wrap up, I'd like to look ahead to the future. Now these new figures are out, what's next for PaRIS? How might the data evolve, expand in the coming months and years, and are there any other outputs that are coming?
Sure, there's so much more ahead. First, We want to make sure that the insights from this first wave of data are widely known and are widely used to support better policies across countries. Our ambition is for PaRIS to have the same kind of impact that other big OECD surveys have had, like PISA had for education, or PIAC had for adult skills, but this time for PaRIS, focusing on health and well-being. We're already preparing also further analysis to explore new angles, such as what are the impacts of long COVID in experiences and outcomes. And similarly, we're preparing analysis for patients with cancer or patients with cardiovascular diseases, and a new analysis exploring the angle of gender disparities in outcomes of experiences. But what's also very exciting is that we're gearing up for a second cycle of the PaRIS survey, aiming for 2029. Countries that participated in the first time will be able to track their progress over time and see the impact of their policy changes in the new cycle. And for countries that haven't yet joined, this is the perfect opportunity to jump in and be a part of a revolution in how we assess and improve healthcare systems everywhere.
Thank you for telling us all about that revolution, Frederico. Now, that's all we have time for today, so thank you, and thanks, Michael, for joining us.
Thanks for having me, Ashley. Stay healthy.
Thank you for having us. It's been a pleasure.
Well, that's all for this episode of Behind the Numbers. We've explored how PaRIS is revolutionizing our understanding of healthcare through patients' eyes. From the complexities of managing multiple chronic conditions to the importance of trust in healthcare providers, this survey goes where most indicators haven't, directly into people's lives. Today's look at the PaRIS survey underscores that living longer doesn't always mean living better, especially if chronic conditions aren't managed in a way that reflects patients' experiences and needs. If you'd like to learn more, you can find the new PaRIS figures and more on OECD.org. You can also check out the frequently asked questions on how PaRIS data can support better policies, better care, and ultimately, better healthcare outcomes for everyone. A special thanks to all our guests in this limited series, especially Michael and Frederico, for taking the time to share their expertise. Join us next time for more insights on the OECD statistics and data helping us to make sense of our economies, our societies, and the world in which we live. Until then, you can find us on LinkedIn, on X or on Blue Sky at OECD Statistics, or reach out to us via email at stat.contact@oecd.org. As always, stay curious and keep exploring the world of data.